Hi, so today we're going to be doing the oculomotor testing. We're going to be testing for gaze holding nystagmus, saccades, smooth pursuits, VOR cancellation, head impulse test, and as well as the DVA, which is dynamic visual acuity. So these tests just kind of help differentiate if vestibular issues are stemming from the central versus peripheral system. You'd really want to do these oculomotor tests on any patient that comes in with vestibular symptoms such as dizziness, vertigo, lightheadedness, feeling off. And you also would want to do it on patients that are having any kind of visual issues such as blurry vision. Any of the red flags such as the 5Ds, diplopia, dysphagia, dysarthria, dysmetria, and asymmetric muscle weakness, blurred vision, hearing loss without dizziness, changes in consciousness. For any of those, you definitely would want to do this. For all of these tests, an abnormal finding would be saccadic eye movement or nystagmus. If the patient has these abnormal findings with any kind of test where the head is not moving, such as the sustained nystagmus or saccades, then that means that it's a central issue. If the patient has more than 2 saccades for the saccades test, then that is abnormal. Visual acuity testing should be done on all vestibular patients. If they have a finding of 3 or more lines discrepancy, then that is a abnormal finding. If they have within 2 lines discrepancy between the static and dynamic test, then that is considered normal. The head impulse test is indicative of a peripheral finding if they have more than 2 corrective saccades. Hi Megan. Hi. I'm Danielle. I'm going to be your physical therapist today. We're going to be doing an oculomotor exam, which is just kind of testing your vision, seeing how your eyes are moving, and we're going to try to differentiate if your visual issues are coming from your brain or the vestibular system in your inner ear. So we're going to be doing a few tests with your head still, a few with your head moving, and kind of testing your ability to focus. How does that sound? Good? Okay. Stop. Okay, this first test we're going to be doing is for gaze holding nystagmus, and it's just looking at sustained nystagmus. So what that means is you're just going to look at my finger, and I'm going to be looking for any eye movement, any kind of twitching or jumping of your eyes. Does that make sense? Mm-hmm. Okay, so first we're going to start right here on the right side. Just stare at my finger, and I'm going to be observing your eyes. Okay, now we're going to do this side. Now we're going to do up here. And down here. Now we'll be holding up your eyelid to make sure there's no saccades and no nystagmus. Okay, you can stop. And go. Okay, the next test we're going to be doing is called the saccades test. So we're basically just trying to see how your eyes can adjust to different targets. So we're going to be going back and forth between the tip of my finger and my nose. I know I have a mask on, but just imagine my nose being right here. Okay, and what I'm looking for is to see if you kind of have to correct, if you go too far or don't go far enough and have to kind of get there, or if you go too far and have to get back to the target. So you're looking for just going from my nose to my finger, and I'm going to see how your eyes are moving with switching targets. Does that make sense? Mm-hmm. Okay, so first I just want you to look at my finger here. When I say nose, I'll cue you to go to my nose. When I say finger, I'll cue you to look back at my finger. And try to just focus on those 2 targets, okay? All right, nose, finger, nose, finger, nose, finger. Okay, now we're going to try with some moving targets, okay? All right. Nose, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, nose, finger. Okay. Okay, this next test is going to be called pursuit testing, and I'm just testing your ability to smoothly follow a target with your eyes. Does that make sense? Mm-hmm. So I'm looking for some abnormal findings would be any catching, any, like you're having a hard time keeping up with the target or things like that. So what I want you to do is just follow the tip of my finger, and I'm going to be starting with the horizontal plane, okay? So I want you to just follow my finger, back and forth. Good. Now we're going to do it on the opposite side. Okay, great. Now the next test that we're going to do is also going to be following my finger, and this is going to help me kind of assess for saccades or any other abnormal findings, okay? So just follow the tip of my finger. Awesome. Okay, this next test is called the VOR cancellation test. And what the VOR is the vestibular ocular reflex. And it's just a reflex in your body. And this is testing for the cerebellum's ability to block out that VOR, okay? So what you're gonna do is you're gonna outstretch your hands like this, interlock your fingers, and put your thumbs up. I'm gonna be moving with you. We're gonna move in the horizontal plane like this, and you're gonna keep your eyes on your thumbs at all times. And what I'm looking for is to see if you can hold that target, to make sure that you can stay on that target and make sure there's no what they call saccadic eye movements, which is just your eyes kind of twitching or jumping. Does that make sense? Mm-hmm. So just try to keep your eyes on those thumbs, and we're going to go back and forth a few times. Okay, ready, set, go. Okay, this next test is called the head impulse test. And what it's doing is just testing the integrity of the vestibulo-ocular reflex, the same reflex we were testing previously. So I'm just looking for your ability to focus on my nose with a head thrust. And I'm looking for an abnormal finding, which would be those saccadic jumpy eye movements or just the inability to focus on the target. Does that make sense? Mm-hmm. Okay. So I'm going to get low. I'm going to grab your head. Is that okay? I'll flex you down a little bit. I want you just to stare at my nose, okay? Relax. Okay. Okay, Megan, the next test we're going to be doing is called the DVA, which stands for Dynamic Visual Acuity. So we're going to be testing your static acuity versus dynamic. So first we're going to just read this eye chart like you would at the eye doctor. And that's going to be your static, and then we're going to do a dynamic test. Does that sound good? Mm-hmm. Okay, so I want you to get at a distance to where these last two lines are blurry. Are you at a good distance right there?
Yeah.
Do you need to adjust at all?
No.
Okay, I want you to read from the first letter down as far as you can, and I'll be making sure that you have the right letters.
Okay. E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P C T F B P L T C D.
Okay, that was your first error, so we'll stop on this line. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So now we're going to compare your dynamic visual acuity and see if you can get up to at least 2 lines before that 10th line. Does that make sense? Okay, now we're going to do the dynamic part of this test, where you're going to be moving your head while keeping your focus on these letters and reading them out. Does that make sense? Mm-hmm. So I'm going to be behind you, providing a little bit of support to move your head back and forth. And all you're going to do is just try to read down to that 10th line. And the goal is to try to get at least 2 lines above that. Okay? Ready?
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O B F C T F D P L T C E O. Yeah, I can't read that last line.
Okay.
I think I got part of that.
So you have one error right here. You said
Okay.
F here, and it was supposed to be a P. So you got 1, 2, 3, 4, 5, 6, 7, 8, 9 on the second try. So you're still within the normal limits for static versus dynamic.